Hi, good morning everyone. I'm Dr. Ramya Gangadhar Gowda, Senior Fertility Consultant at Cloud9 Hospital, Kanakapura Road at Belando. In this video, I'll be talking about one of the simplest, most affordable and first line of treatment in the management of infertility, that is IUI, which stands for intrauterine insemination. I call it simple because the patient need not get admitted in the hospital while she is under treatment. I call it affordable because it is not expensive, and I call it very first line of management because this is the simplest of all, and you can once a couple try naturally, and if the pregnancy doesn't happen, they can go for the next level, that is intrauterine insemination. I'll tell you how the treatment works, then I'll tell you the advantages and disadvantages of the treatment, then I'll tell you what to expect after the treatment. As we all know, every woman releases one egg in a month, either from the right ovary or from the left ovary. And at the time of ovulation, when they have an intercourse, the husband deposits the semen here, and the active motile sperms are ascended through the uterus, will be traveling through the tube, fertilizing the egg, and once the fertilization completes, the embryo will be pushed back to the uterus and starts growing there. This is how the normal human reproduction works. When a couple fail to conceive by this way, then we ask them to go through this treatment called IUI. In this treatment, we track the ovulation of the women through ultrasound, serial ultrasound, probably 2 or 3 ultrasound, starting from the beginning of the periods. Of course, there are many other ways of detecting an ovulation, but the most accurate one is the sonological method, that is through the serial ultrasound what your doctor does, along with certain blood tests. Once the date of ovulation is predicted, a woman's husband will be asked to give a semen sample through the masturbation in a container, and this semen will be washed with multiple stages in the lab. In this process, the seminal plasma, which is rich in chemicals, prostaglandins and dead motile sperms, will be separated, and the active motile sperms will be taken out. These active motile sperms will be loaded into a simple catheter, and through the help of this catheter, the semen will be deposited in the uterus. From there on, the motile sperms will be traveling through the tubes, and the remaining fertilization, then all those growth, everything still happens naturally. So this treatment is very similar to the natural try, except that in this process we are removing the immotile and dead sperms with seminal plasma. So the advantages, as I told, it is affordable, simple, it doesn't involve any invasive methods like pricks or cuts. Then the disadvantage is, since everything still has to happen naturally, like sperm meeting the egg and then fertilization, everything, the pregnancy chances are just 15 to 20%. And again, it depends on multiple variables. If the woman's age is less than 35, she has a better chance. If a woman has healthy and patent tubes, fallopian tubes, then she has a better chance. If the tubes are unhealthy, then there is a very high chance of women ending up with an ectopic pregnancy. And if a semen parameters are compromised, then the chances of pregnancy with IUI comes down. But if all the parameters are normal, like if the age is favorable, if the semen parameters are normal, the fallopian tubes are healthy, then you can try up to 6 cycles of IUI. In spite of trying 6 cycles of IUI, if the pregnancy doesn't happen, then you can go for a next level treatment, that is IVF or in vitro fertilization. Thank you.